One.
Okay, I am going to demonstrate the proper application of CPR and use of a tourniquet to control bleeding. So first thing, upon arriving on scene, you want to make sure that the scene is safe, that you have your PPE, gloves, mask, goggles, and gown if needed. And you're going to immediately call for ALS backup. Usually fire and police will already be en route. So the first thing you're going to do is, sir, you want to check the consciousness of the patient. Sir, are you okay? Are you okay? And assuming the patient is unconscious, the first thing you're going to want to do is listen to their breathing and check their pulse, carotid pulse at the same time. Now, assuming the patient is pulseless and apneic, you're going to want to immediately begin compressions. You're going to want to do 100 per minute at a depth of about 4 inches, and allow proper recoil of the chest. After you've done 30 compressions, you quickly tilt the jaw back, perform 2 rescue breaths, looking for rise of the chest, and then you're going to continue compressions. Then, while you're doing this, your partner, right here, will be fetching an automated external defibrillator, or AED, and while they're getting it set up, you're continuing compressions and continuing rescue breaths. Now, assuming they have it set up, you're going to turn it on. You're going to follow the directions listed on the pad and apply them to the patient. Then the AED will check for any sort of cardiac rhythm. And then you're going to say, all clear. Everyone's going to step away while it checks. And it may advise that a shock is needed and perform the shock, in which case everyone will be away from the patient. There'll be no motion of the patient. Or it will say no shock advised, in which case consider, if there is still no pulse, you would continue compressions until your ALS backup arrives. Now, of course, if the patient has any clothing on, you would have wanted to bare their chest, assuming this is our patient, bare their chest so that there's nothing interfering with the reading of the AED. Now, in the case of a wound, I'm going to use my leg as an example. In case of a wound, the first thing you want to do is get some gauze, sterile gauze, and apply pressure to the wound. And usually it's pretty noticeable if the wound's continuing to bleed heavily after you've held pressure for a little bit, in which case about 2 fingers, or let's say 4 fingers about here, 4 fingers up from the wound, you're going to want to apply a tourniquet. And since we don't have one, we're going to use this scarf as if it were a triangle bandage. So you don't want to tie it too tight together, but you want to roll it up like this. Now you're still holding pressure there, or maybe your partner is, and then you're going to, let's see, like this, tie a knot from below at the top. Now, granted, you'll be doing this a lot tighter, but you want to make sure that there's absolutely no pulse after you've applied the tourniquet. Now, then you would use a bar or something very strong that won't break, apply it on top. You would make another knot on top of it. Now this would be to help tighten the tourniquet. Tie a knot, and provided that the bandage is still, there's still length, you would tie 2 knots at the bottom underneath, so it's totally secure. You would want to write the time that you applied the tourniquet and you of course twist the metal bar to tighten it until you could no longer feel any sort of pulse down from the tourniquet. You want to leave the tourniquet, and if you don't want to apply it at a joint or at the knee here, it's not going to work well. If it's still bleeding, regardless, you would add another tourniquet up from that same tourniquet and continue to write the time that it was applied. That's it.